Hi, my name is Dr. Mark Allen Dery, and I am the Medical Director of Infectious Diseases with Access Health Louisiana. I do a daily 10-minute podcast about relevant COVID-19 topics, and it's called Noise Filter. And you can find all of those podcasts on all the various podcast platforms. Please subscribe to that. It's really high yield information, 10 minutes every morning. You'll enjoy it. So, speaking of COVID-19, I wanted to say a few words about the loosening of restrictions that we will soon be seeing in Louisiana and in New Orleans. Now, while there is no question that we have collectively done a stellar job of consenting with the stay-at-home orders that has been asked of us by the governor and by our mayors, we did what we were asked. We actually flattened the curve and we helped our healthcare workers and our healthcare system to not be overwhelmed with sick patients with COVID-19. So now that the ordinances will be loosened a bit, I wanted you all to be aware of a few things. The first is that the virus has not gone away and will be with us until there is a vaccine. And that may be a year or so. So the second thing I wanted you all to know is that the virus is overwhelmingly transferred by the respiratory route. That means that if somebody close to you laughs, sneezes, coughs, or even if they talk near you for more than a few minutes, there's a risk that you can actually get the virus. So remember, this virus is transferred to people even if they are asymptomatic. That means that they have no symptoms, or if they're pre-symptomatic. That means that they will get the virus sometime later, but this is a time where actually they're not having symptoms from the virus and they can still transfer that virus to you. So let me end on a few very pertinent case studies. There was a man who went to eat in a restaurant in China that the CDC documented. So this was in a CDC document. A man goes to eat at a restaurant in China a few weeks ago. He was pre-symptomatic, right? So it was before he had symptoms to COVID-19. He didn't know he had COVID-19, and he inadvertently infected 9 other diners at a restaurant. And one of the reasons was that there was an air conditioning unit that was at a 90-degree angle from him. And so you could see that the virus was able to transfer that way. There was a second case study of a man in Seoul, South Korea. And after they opened up, the bars and the nightclubs opened up, and this man went and he went nightclubbing and went to various bars. And now he is directly responsible for several dozen cases as well as a result of going to nightclubs and bars. There was a birthday party in California with a family that was following social distancing orders, and there's also a choir in Washington State that were all masked and also social distance. Both of these were examples of cases that were transmitted of folks indoors in a social setting. Lastly, I want to talk about the recent protests that we saw recently in a northern state. 72 cases were documented as a result of that protest. So there was a restaurant where transmission occurred. There was bars and nightclubs where transmission occurred. There was a family gathering of a birthday party and a church gathering of a choir that got together, and there was transmission that occurred. And there was an outdoor event like that protest, and there was still transmission that occurred. So let me just say this. If you do decide to be outdoors as the state loosens its ordinances, I ask you just a few things. Please wear a mask when you go outdoors, and ask those around you to do the same. The mask that you wear, right, protects others from you. Let me say this again. The mask, right, the mask protects you from me, because I may actually be pre-symptomatic or asymptomatic. Again, the mask that I wear keeps my potential virus in my mask. And the same goes for you. When you wear a mask, you're protecting me from you. So let's please stay at home as much as possible, wear masks whenever you're out and about, and always wash your hands. One last thing. Children's vaccination levels have been going way down. So please contact our clinics at Access Health Louisiana or your child's primary care provider to figure out a way to get them vaccinated. At Access Health Louisiana, we wish you and your family safety, happiness, and an abundance of health.